Okay, Mr. Jones, that's you sorted for another 6 months. Let's just sit you up. I'll have your glasses. And then what I want you to do is take a good old swill of that mouthwash there on your left, and we'll see you in 6 months' time. Thanks, Pete. You want to sort Mr. Jones out for me?
Yeah. We'll get you up to reception and organise that appointment. Are you all right?
Something's wrong. Oh, my lips feel all tingly and funny and a little bit short of breath.
I think there's something wrong with Mr. Jones.
Oh, okay. How are you feeling, Mr. Jones?
If at any point the patient seems unwell, stop treatment, make the situation safe, get help, and locate your medical emergency equipment, including treatment algorithms.
Oh, something's wrong with my lips and my mouth, my tongue.
Paddy, if we get the emergency equipment out, and you're a bit breathless, I can hear.
The patient can't complete sentences in one breath and is wheezy, so there is an airway problem.
Okay, let's give him some oxygen, Purdy. And then he's wheezy straight away, so let's have some Ventolin as well. 15 litres, please. So just going to pop that over your head. Okay, so this is a drug called Ventolin. It's going to help with your breathing. 5, 6, 7, 8, 10. Okay, so what I want you to do is take nice deep breaths. Okay, every so often I want you to take one big deep breath, going to get right in the bottom of your lungs. That's excellent. Well done, Mr. Jones. Okay, Purdy, I think if we call Anthony in here, some adrenaline, please.
Anthony, can you come in, please?
Let's just get you back of this oxygen, Mr. Jones.
Count the respiratory rate. Attach oxygen saturations if you have it. Consider the colour of the patient and look for normal chest movement.
Purdy, can we have some adrenaline and the algorithms, please? Oh, Anthony, Mr. Jones is having an anaphylaxis reaction. Dial 999. Tell them we've got a patient that's having an anaphylaxis reaction. He's conscious, but he's not breathing normally, and that we're about to give him some adrenaline, and then come back and give us a hand. All right, okay, so anaphylaxis. Okay, if you can get 0.5 milligram ready, Purdy, for me.
Yes, that's the correct address. Yes, that's the correct telephone number. He is conscious. He's breathing, but he's making funny noise when he's breathing. Yes. But oh, the dentist told me to tell you that he's giving me adrenaline. Okay. Yeah, I'm waiting for the car. Thank you.
I'm just going to take your pulse, Mr. Jones. So that's... Okay, lovely. Anthony, can you grab Mr. Jones's notes and then start writing everything down?
0.5 milligram.
Okay, let's give it into his deltoid muscle there.
Sharp scratch.
Okay. Lovely. Okay, Anthony, 0.5 milligram of IM adrenaline given at...
It is important to document what happened as it happens if possible, to ensure accuracy of times, drug doses and the condition of the patient.
Okay, let's have a blood pressure now, Purdy. You're getting starting to get itchy now. Okay.
Feel for pulses, assess capillary refill time and check blood pressure if you have the equipment. Also feel the skin temperature.
Okay, capillary refill time is 4 seconds. We're just going to do your blood pressure, okay, and the ambulance has been called, and that drug that we've given you now will help with what's going on, okay? So what's his blood pressure, Purdy?
90/50.
Okay, then we should sit you round. So if we get you round, just get your legs up. Okay, and if you pop that sats back on there as well. Let's do a blood glucose.
In disability, assess level of consciousness by using the AVPU score. Check the patient's blood sugar levels, and if they're conscious, ask them to move their limbs to look for any signs of weakness. If confident to do so, check the pupil reaction to light.
And then we're going to have a quick look at him. Mr. Jones, I'm just going to look at your chest.
Exposure of the patient in the dental setting can be difficult, so whilst respecting dignity, look for signs of rashes, bleeding, injury or bruising.
Okay, we got a rash all over his chest, Anthony, so write that down for me. Okay, let's just recap what we've done. Okay, so write this down, Anthony. So his airway is still wheezy and he's still stridorous. Breathing, his respiratory rate was 28. SATs are 91%. Pulse rate, that was 120. What was his blood pressure, Purdy?
90/50.
Okay, so it's 90/50. If you could redo his capillary refill
Sure.
time for me. Blood glucose, what was that? 14. Okay, and we've got that widespread rash.
4 seconds with
Okay,
that
so
refill.
capillary refill time, 4 seconds. So he's still wheezy, Percy. Let's get him some more Ventolin. Anthony, when did we give him the first adrenaline?
5 minutes ago.
Purdy, if you can drop him 0.5 milligram of adrenaline for me. Okay, Mr. Jones, you're still wheezy there, so I'm going to give you another lot of this Ventolin. So just as before, just take nice deep breaths, and then every once in a while, nice deep one for me. That's it. And then when you're ready, Purdy, you can give him his second dose.
Another scratch coming, Mr. Jones.
Okay, so second dose going in at 3 o'clock. And,
Hello, paramedic here.
oh, hello. This is Mr. Jones. I think he's having an anaphylaxis reaction to the mouthwash that we gave him. He's a 40-year-old gentleman, no past medical history or any allergies, and he was here today to take out a molar. Airway, as you can hear, very noisy, wheezy, stridorous as well. Respiratory rate is 28. His SATs are 91. His heart rate is 120. We've got a blood pressure of 90/50. His capillary refill time has been 4 seconds. His BM is 14, and he's got a widespread rash on his trunk. So, you know, we're here to help you when you want us to do.
Okay, thank you. How are you feeling now, Mr. Jones? Can you continue to look after his airway? Then I'll get an IV in.
So in summary, if you think someone is having an anaphylactic reaction, stop dental treatment, make the situation safe, and assess the patient using the structured airway, breathing, circulation, disability, and exposure approach. Call for help and give high flow oxygen with the correct oxygen mask. Treat the patient with 0.5 milligrams of intramuscular 1 in 1,000 adrenaline and repeat if no improvement every 5 minutes. If the patient is also wheezy, treat them with up to 10 puffs of salbutamol via a spacer. Use algorithms to remind you of the treatment guidelines and ensure the emergency services are called early. Prepare for handover, document what happened as it happens, and debrief your team after the event.